So welcome back, everyone, and thank you for all being here. My husband and I generally have a rule of no CME after lunch, so I'm breaking that to be here, and I'm happy to see that you all showed up. So before I start, can I just get a show of hands of anyone who is currently doing DPC, so has already opened or is in a hybrid DPC? Okay, so a few people. So these are the people at your tables that you'll want to catch afterwards and ask how they're doing things. And then show of hands of people who are thinking of doing DPC or in the planning stages. Okay, good. So almost everybody else. Great. So this is, I have to admit, I haven't read this slide, even though it's in my presentation and everyone else's, but I think it says, you know, don't really believe everything I say. I'm not really sure what I'm doing. We're all just figuring this out together. And this, I have nothing to disclose. Nothing would make me happier than to see each and every one of you open your own DPC practice or join with another physician who's doing DPC. I really think this model offers hope for us as individual physicians and hope for the future of our entire profession. We're going to go through basically a huge checklist today of all the steps you need to do to open your own DPC practice. So get ready for the first question. So first question is just, how confident are you in your ability to do this? So I could never do this, not sure, maybe, I think I can, or I got this. And I love this picture of confidence. Just speed up a bit, you got this, with the cliff in between. And I think that sort of cliff feeling is what each and every one of us who's opened a DPC practice has faced. You know, no matter how much you read and prepare and talk to other doctors, there's that moment where you just have to take the leap and trust that the road is going to be there on the other side. All right, good. Great. Great, I love it. So we've got some good confidence overall. All right, and then one other question, just to get a sense of where you all are coming from. So for those of you who are currently doing DPC, just kind of what you were doing previously, and for the rest of you, what are you doing now? Okay, so a pretty good mix. For those of you who are owner of private practice, about 25–30%, just feel free to sit back and relax, because some of the things I go through here you will already have done. So feel good about yourself that you've already checked off many of these boxes. I included this picture, which is a picture of Dr. S.S. McGinnis sitting in front of his office with Roy Martin and a dog between 1920 and 1929. And I included this because for me, so I graduated residency in 2006. I had almost no role models of someone who graduated and opened their own practice. Everyone that I knew, everyone in my class went to some sort of employed position. And I think that has only been happening more and more since I graduated. So I just put this in as a reminder that it wasn't all that long ago. I mean, this picture was a while ago, but even in my parents' generation, sort of the norm was for family medicine, primary care doctors, we would finish our training and go hang our shingle and open a practice. And we've moved away from that, but DPC is really bringing that back again, and I think that is going to be the salvation for our profession and for our patients, honestly. I had no intention of ever being a business owner or opening a business. I had never taken a single business class before I did this. And when I was sort of in the planning stages, I spoke with a physician who had trained in the 70s when family medicine was brand new, and he had gone on to open his own private practice. And I asked him, like, how did you know what to do? And he told me, if you're smart enough to make it through medical school and residency, you're smart enough to open a practice. And it's so true. I mean, I've thought of that many times. There's a lot of new things to learn, but we're really good at learning new things. That's what we're used to doing. And it's really fun. I had someone yesterday say, like, I'm interested in this, but I don't want to be a business. And I said, why not? Being a business is fun. And I think one of the disservices that certainly my medical education did was people never talk about money. It's like we're embarrassed as physicians to admit that we need to think about money. And I think that's because most of us went into this, we really feel this is a calling to care for others. But that doesn't have to exclude making enough money to feed our children and have a roof over our heads and, go on vacation once in a while. So I think we need to not be embarrassed to talk about how to make money. So to start, when you're thinking about DPC, I think the most important thing to start with is just some real soul searching of what does your ideal practice look like. And people told me this ahead of time, like, you can make this however you want, and I didn't believe them, but it is true. Like, you can really make this, as long as you're meeting a need in your community, you can really design this for something that works for you personally, that brings you joy. And so things to think about are like, who do you want to take care of? That's probably the most important thing. What ages, what income level? Do you think of having a small practice? Do you want to be on your own? Do you want to have partners? Do you want to have employees? What kind of services do you want to provide? So many of us have talked about doing home visits. To me, that's one of the more joyful parts of the practice. It's just something that's really fun to do. Do you want to do procedures? That's something you'll have time to do lots of. Do you want to do hospital care? Do you want to do OB? And then any services that you do not want to include. So this was one of the harder things for me to kind of wrap my mind around, because I had worked in employed academics for 9 years, and so I was sort of told what I did and did not do. And so to be able to kind of make the decisions for myself about this is what I want to do and this is what I don't want to do, it's really a wonderful thing. And then thinking about your location and your schedule. So this was my original to-do list, which got messier and messier as the months went on. I'm going to try to make it a little bit more organized for you all today. So we're going to start with first things first. So these are the things you need to kind of start thinking about in the beginning. So choose a name, and when you're choosing a name, you're going to want to Google registering a business in my state, whatever your state is, because you want a name that someone else doesn't have, so you can register it. So I originally wanted Blue Ridge Family Medicine. That was taken, so okay, Blue Ridge Family Practice, that works. And then you want to think about a logo. So there's lots of ways you can do a logo. You can do it yourself. There's free graphic design software that's online that's easy to use. There's crowdsourcing, 99 designs, and that sort of thing that you can put in a bid, and people will submit what they've come up with. And then you want to start thinking about, like, when am I generally going to plan to start on this? And you have to think about, like, what are my contractual obligations with the job I have now, if that applies, and then Medicare opt-out. And we'll get into that a little bit later. And then think about your initial hours, and then finding a physical location. So finding the location is often what will take the longest. So even when you're in really early planning stages, I would recommend just like driving around and thinking about where you want to be, because that is nice to have when you're ready. So Office Space, not the movie. Decide where you want to be and whether to buy or lease. So we've talked a little bit about that. For myself, again, I have a small solo micro practice, no staff, so I really was looking low overhead. In the beginning, I wasn't really sure, like, is this going to work? I don't know. So I decided to lease. And as Dr. Forrest mentioned, you don't need a large space. Depending on how big, you might want to have some extra space if you're going to sublease, or if you're thinking you're going to grow the practice. But I have a 967 square foot office space. I originally outfitted 2 rooms because I was in the sort of fee-for-service mentality where I ran out of 3 rooms, and that sometimes wasn't enough to keep things moving along. And then I realized shortly, like, there's only one of me, 1 room is plenty. So I now sublease that room, the second room, to a podiatrist, and I sublease a smaller room to a massage therapist. So there's lots of creative ways you can kind of do that and keep your overhead low. Many people, or some people, will also consider subleasing a room in another practice, so that's a way to keep the overhead super low. Sometimes people will do that while they're kind of still looking for their office space, just to have a spot to see patients. Some people have done home visits only when they're still looking for their space, so kind of getting started and offering the home visits. I found actually that most patients really want to come to the office. Like, most people don't want you to come to their home unless they're really ill or can't get out for some reason. So for me, having a professional looking warm office space was really important. And because this model is a little different, oftentimes when people come in for that initial meet and greet, they look around and they're like, oh, this is like a real doctor's office. And I'm like, yeah, I mean, what did you expect? But so I think that is important to have a nice looking space. And then some people will, if your zoning allows, you can also work from your home, and some people find a way to do a home office there. And then in terms of finding a location, you can work with a realtor, searching local listings, even like Craigslist, and then driving around the area, I think is one of the best, just to kind of see what it looks like, what would this feel like to be here. And then when you're looking at outfitting your office, so first of all, physical space, exam tables and stools, comfortable chairs, art for the walls. There's really not that much that you need. And looking for retiring docs in the area or practices that are closing, you can get some really great deals on the larger items. And just to mention how wonderful DPC doctors are, so when I opened 5 miles down the road from another doctor in our area who was the first to do DPC in the area. And I went and talked to her before I opened, and she gave me an extra exam table, an automatic exam table that you can move up and down, which I'm sure cost thousands of dollars. She had bought it from another physician who had gone out of business. And so that just shows you with direct primary care, like, we are all here to help each other. So I really encourage you to connect with the people who are local to you. You know, I live in a town with several large health systems, and you would never see one of the health systems saving all their surplus and just donating it to the other health system. But it just really shows one of the wonderful things about DPC doctors. And then one other thing I'll mention about the great deals. So I also got pretty much everything else I needed at an auction. There was a clinic that had sort of a nonprofit that had expanded into the clinical space, had ironically like overbought, and that was part of why they went out of business. And so I showed up for the auction. It was like a real auction. We had to bid on stuff, and I was the only medical person there. Everyone else just wanted like the nice office chairs. So I got an EKG, really nice machine. I don't think it would ever been used for $5. I mean, I outfitted everything for less than $1,000, everything in the office. So be on the lookout for stuff. Tell people you're going to be opening, and you may come across something like that. And then in terms of physical space, just signs inside and outside your building. Medical supplies. So there's all sorts of lists around. Atlas MD has a list that you can access on their website of medical supplies. But I think the easiest way is just to keep track of what you're using now. I mean, you're probably going to have a similar type practice to what you're doing now, or you can focus on what you're doing that you want to keep doing. And it's really not that much. I think we're used to, many of us, these big offices that have these huge supply closets. You really are not going to need that much. And in most places, so I use McKesson as my local kind of medical supply thing. I also use Amazon and like Target and Walmart, whatever, for some of the non-medical stuff. Pretty much every place delivers within 48 hours, so you can just keep a small stock on hand. When you run out of something, you just reorder it. And I probably spend less than $1,000 probably most years on those disposable supplies. So it's really not a huge expense. And then group purchasing organizations, so these are things where people band together and get better pricing. If you're part of one or you find a free one to join, great. I found that wasn't really necessary because I sort of got the pricing that other local practices had, and it's just not that much money. So don't stress. I wouldn't like pay a lot of money to become part of a GPO. And then other office supplies to think about, just your business cards, your letterhead, brochures, all the things to make you look professional and to help market. Again, there's canva.com is one free graphic design online site you can use to do it yourself, or you can get help with that, and then just print it locally or online. All right, so pricing. This is a big question, of course, for everyone. So assuming you're not going to go by The Simpsons, Dr. Nick Riviera, if I kill you, you don't pay, marketing strategy, you need to kind of figure out your pricing and marketing around that. All right, so here's the basic equation. Again, I'm not going to talk about any specifics, but if you just think about what are your operating costs, and for most people, the most expensive part of your operating costs are going to be any employees that you have. It's probably going to be the number one. Second is going to be your rent or your mortgage. And then everything else kind of falls into the other category. Malpractice is going to be very state dependent. That's that's up there for me. But again, if you're part-time, that really dramatically lowers that. And just to give you an idea of malpractice, because I think people sometimes an employed physician think it's going to be way higher. My policy in Virginia, I think started at $2,000 a year, and then it like increased every year over 4 years up to $7,000 total for the year, and then it's like less than half of that being part-time. Again, that's going to be locally specific. So you got your operating costs, and then think about how much money do I want to make? Like how much do I need to make? How much do I want to make? That's going to give you your total amount of money that you need, and then just divide that out by your expected numbers. So again, solo micro practice, people might be able to kind of make what they need at 200. Mature practice with employees, maybe around 600 or so. So kind of divide that out. You can play around with the numbers, but that'll get you your average per member per month cost. And then once you have that kind of ballpark idea, just figure how you're going to break that down per individuals, any family discounts. So many people, I think as we've mentioned, will do some sort of kind of breakdown depending on age. Often people will give a discount for kids if they want to, like I really wanted to keep whole families in the practice, so my kids are half price if they're enrolled with a parent. Kids can enroll on their own, but they're full price if they do that. Oops. Okay, so this map was, Jay Keys had this on one of his slides. This is dpcfrontier.com. It's the mapper that Phil Eskew updates constantly. Phil will be speaking later. He's a lawyer and a doctor, and at any given time, the smartest person in the room. And as of last month, there were 845 DPC practices listed on this mapper. And this is, I would say, the most up-to-date, like best resource for this, and it probably doesn't include every DPC practice, but anyone who's active, I would definitely send your info to Phil and get it listed on here, because it's a nice way to know who's available in your area and kind of connect with those doctors. The really cool thing about this is you can hover over any of those little dots, and it will give you the website of the practice, and so you can click on that and see how different practices have broken down their pricing. You can see what their website looks like, kind of see how they're explaining DPC. And so that was something that was really helpful for me when I was kind of looking into this. And then just a few other things to think about with doing your pricing. So there's something called billing in arrears. And for those of you with no business background like myself, that just means billing for the prior 30 days rather than the patient paying you at the beginning of each month for the service to come. They're paying you at the end of the month for the service you've already provided. And I'll defer to Phil for kind of how important this is now. In states that do not have DPC legislation protecting DPC, this might be a little bit more important because theoretically someone could sort of accuse you of operating like insurance if the patient's paying you at the beginning for these services to come. So the way I do it is I do bill in arrears, but I have the patient pay what's termed a registration fee at the first visit. So I get paid at that first visit and then every 30 days thereafter. And then for the enrollment fee, so many practices do charge an enrollment fee. For my practice, I was trying very hard to keep it affordable to almost anyone. So for me, the enrollment fee is the same as the monthly fee, whatever that is for the age group. Many practices charge an enrollment fee that's a little bit higher because that first visit is generally longer. You're often looking at old medical records. It's taking time to put it all into the electronic medical record. So there is a lot of work associated with that first visit. So I think charging more for that first time enrollment fee is also very reasonable. Many practices choose to do a re-enrollment fee, and that is just something designed to discourage people dropping coverage or dropping care, dropping seeing you, and then re-enrolling later. And then it's possible to charge your sort of monthly membership fee and then also charge a per charge visit. I chose not to do that because sort of the feedback I got was it's not really necessary and it's just a little more hassle. To be still considered like true DPC, the per charge visit just has to be less than what your monthly fee is. And so some people, might choose to do this just to discourage like unnecessary utilization of office visits. Honestly, I have not found that that's an issue. Most patients have much better things to do than come into the office. And if someone is really overusing, then that's sort of a separate conversation. So employees, I've touched a bit on this. So many practices will start with one person for physician, or if it's a two-physician practice, sometimes one person to assist both of them. which can be a phlebotomist or nurse, or, the person is really much more important than even the skill set that they have. So when you're thinking about hiring someone, I think having a person who's really a good fit for the practice is by far the most important thing. And they often will help with sort of everything that you're not doing. So front desk duties, triaging calls, rooming patients, drawing blood. And then other practices find doing this themselves is very manageable, especially when starting up, or if they plan to keep the practice small. And I will say I've found it very manageable. I actually love drawing blood. It's one of my favorite things now that I'm doing it. It's very satisfying. But if it just sort of, I think, depends on what you want to do and how big you're planning to grow the practice. You can always start out without someone and then add them later if you're really trying to keep your costs low. I would say just working on hiring the right person, because having to fire someone, from what I've heard, is really hard. And so, I mean, you can do it, but it's just sort of emotionally challenging. So I think starting with the right person if you're going to get someone. All right, labs and pathology. So most practices offer discounted labs. It's a huge benefit financially for the patients. You can use national labs or local labs. I went with a local lab because they were already offering to my colleague really great pricing that they were willing to give to me. Most of our common tests are less than $10 each. The lab, no matter who you use, I talked to the national groups too. They were also willing to give good pricing. The lab will provide the centrifuge. They'll provide all the supplies except gloves, typically, so you don't have to worry about buying all of that. And then the way it works, so in my office, the patient and I have our visit. If there's lab work that's indicated, we talk about it. I can actually give the patient for each test the amount of money that it's going to cost them. Depending on their insurance, they may want to actually use their insurance, and I have a little switch I can toggle back and forth. So if they have Medicare and it's going to pay for their labs, they can use that. If they want to do cash pay, then I just charge them that amount that day. I put a little sticker on the lab form that I sent to the lab, and then at the end of the month, the lab bills me for all those lab forms with a sticker on it. So it's pretty simple. Do check your state requirements. My understanding is New York and New Jersey may be difficult or not possible. And again, the patients can use insurance if they wish. And then you want to decide if you're going to charge any markup for the labs. Most practices do charge a little bit of a markup because just to cover costs. So you don't want to be losing money on anything you're doing, and so a few dollars or so. And then for pathology services, a little bit different. Some states have laws against price markup for physicians. Virginia is one of those. So for like the pap smears I do, I'm not allowed to add on anything for marking that up. And then other states require disclosure to patients of the actual cost and the markup charged. DPC Frontier, that website with the mapper, is a great resource. You can actually go on and click on each of your, like, the state-specific recommendations, and with links to things for that. And, in terms of disclosure, most likely you're going to want to disclosure pricing because part of what we do is offer transparency to patients in terms of pricing, and it's also amazing marketing. I mean, patients cannot believe what savings they achieve from that. And then in-house dispensing. So another potential great financial benefit to patients. There is some administrative overhead, so you've got to stock the meds and you've got to be able to, have someone taking time to dispense them. Check your state guidelines. Some states make this much easier than others. Some make it almost impossible. And then if you do in-office dispensing, so you're going to, again, decide whether to mark up your medications. Many practices will just mark up by 10% to cover the costs of the bottles and bags and all that sort of thing. Sign up with a wholesale distributor. I think Andameds is here. I know that's one that offers, that a lot of people will use. And then you also want to think about when you're choosing your EMR or other system, something that can manage your inventory. And then if you don't dispense, so Virginia makes it pretty difficult. I at this point, I'm not dispensing. But again, you can use GoodRx or other kind of local independent pharmacies, kind of help patients know where to go, help them price out the meds ahead of time. So imaging, a lot of practices have been able to negotiate low prices with local centers. Some states have what's called certificate of need legislation. Virginia is one of those. So around me, everything is owned by a large health system. I pester the rep every time they come by to lower the prices, and so far I've been unsuccessful. There is a center, an independent center that's a little bit over an hour from my practice, so if people need a CT or an MRI, it's often worth it to them to drive a little bit. And then there's also something that I mentioned yesterday, which is MD Save, and you can go online and look at that. One of the local hospital systems does participate in that, and that's a really nice service because the patient can actually go online, choose the study, pay for it, and then I just send an order to that hospital system, and the patient prints out the coupon that they've already paid, and that offers a significant discount. And one other thing that I will do, or your practice can do, all the imaging centers should have a price line, and you can call and compare the costs. Patients really appreciate that because it's something that theoretically they could do, but they don't know, what code to say or what the test is. And for me, I mean, there have been differences of, for saying like a chest CT ranged from $2,550 to $495, all within a 1 hour radius, same exact tests, same codes and everything. And so the patients really appreciate if someone in the practice can take the time to do that for them. And they really feel like they're kind of getting something special that they know they would not get in any other model of care. Vaccines. So this is something that stressed me out before I was starting. I really like seeing kids. I wanted to keep kids as part of my practice. And I could not figure out a way to easily incorporate that into my practice. And I can say, so I don't actually give any vaccines in my practice. It has been fine. And so there's kind of two different ways you can do this. You can give them at your clinic, or you can send patients elsewhere. So if you're going to give them at your clinic, you want to make sure you're following the CDC guidelines, and then also have a power outage plan, because vaccines are really expensive. You may have hundreds or thousands of dollars of vaccines sitting in your freezer or fridge, and that will go bad if the power goes out. You can buy them from a medical supplier. Some practices also will buy them sort of as needed from a local family practice or pediatrics practice. And then local health department may provide some for free for certain patients. So for Medicaid and some other groups in Virginia, that does come with some like requirements of just how you store it and track it and everything, but that's an option. And then if you're going to do that, you're going to have to figure out how you're going to price that for the patients, for the administration, and are they going to try to submit something back to their insurance to get reimbursed for that? Or you can refer out. So for I happen to work across the street from a pharmacy that gives all adult vaccines. They give flu shots for ages 4 and up. So for my adult patients who have insurance, during their wellness visit, I talk about what I would recommend in terms of vaccines, and then I'll often write it down. They don't need a prescription, but I'll write it down so they sort of remember about it and just tell them, go across the street and get it. You can get it today if you want. And so the pharmacy will take their insurance and bill the insurance. So that way it's covered for the patient. Because it's very close, it's not a big hassle for the patient. Local health department for patients who do not have insurance or who have a health share plan that does not cover vaccines, that's a great option. We're fortunate our health department, I actually took one of our kids there because we, just for convenience reasons, ended up doing it. And it was actually a lovely experience. It was like there was no one else there. We met with the nurse practitioner. He got the vaccine. He got a free book. So now I can tell my patients, like, I've taken one of my own kids there. It's fine. And the feedback I've had from the patients who have done that is that it worked great. It was really smooth. And then for my kids with insurance, so especially like the little babies who are going to need vaccines every couple months, I have in the building next to me, there's a local family practice. And so I worked it out with them that they will see the baby for a one-time visit to establish care. That gets billed as a preventative visit, so it's no charge to the family if they have insurance, it's covered. And then they can, after that visit, they can then see me for the wellness visit and just go next door and get the vaccines at a nurse visit. And so I felt that was a nice service because having had young kids, it can be very like hard to drive all around. And so that just made it easy for those families. And then in many states, the local health department will also give vaccines to patients with insurance. And Virginia is a state that does that. So sometimes for convenience, people will just choose to go to the health department if they live nearby. And then specialists. So some people have mentioned you may need to use your specialists a lot less than you did previously because you're just going to have more time to do things, more time to think about things, more time to talk to the specialist on the phone. I love talking to the specialist on the phone, and honestly, they seem to love it too. Like I've had many of them say, like, I wish more doctors would call me. So it's been really nice to kind of have that collegial relationship with the specialists that I just didn't have time for before. There are also organized electronic curbside consults. So Rubicon MD is one of the ones that does this, where you gather the information, you submit it electronically, and a specialist will reply with their recommendations. So it's not like they're not sort of directly seeing the patient, but they're kind of giving you advice like a curbside consult would. And then I would definitely recommend talking to local DPC practices about what they do. So this is one of the really nice things about being in touch with other people, because they can kind of help direct to what's worked for them locally. And the DPC Alliance, if you haven't talked with them yet, there's a table here. This is a group of DPC physicians who has founded this group to help other physicians doing DPC. So its only mission is to help promote DPC. And so I would definitely recommend, if you haven't stopped by that table and joined, to do that. And they can also help you connect to the local people in your area. All right, so website, I'm going to try to breeze through these. I actually built my website myself. I have zero IT background at all. I just had some very specific things that I wanted, and I literally watched YouTube videos, and it took about a week, and I did it. So if you have an interest in it, it's really not that hard. If you don't have an interest in that, you can easily have someone help. So there's freelance programmers. There's a group called DPC Spot that is very affordable. Colin is the guy who runs it. He's worked with a lot of DPC practices. And then you can also solicit like a formal web design studio. So there's lots of ways that you can have somebody help you to do that. And it doesn't have to be super expensive. Ideally, you're going to want your site to integrate with your scheduler if you have that. You want it to mainly be able to load quickly and look good on mobile devices, because most people now are looking at their phone. So you want to make sure that it looks good on all those devices. And then you're going to want to set up an email, ideally something kind of professional sounding with your domain name. EMR is a huge decision. I'm not going to talk about any specific vendors now, but I encourage you to talk to those of us who are practicing and kind of find out what we're using and why. You need to decide on a billing system. I would also highly recommend something automated. The system I use, the patients online enter in their credit card or checking account. I never even see that information. It's in there securely. I activate it once I see the patient the first time, and then it bills them every 30 days. I never think about it unless it gets flagged because something didn't go through. And usually that's a credit card that got lost or stolen or hacked. And so the billing system will actually email the patient several times. If the patient doesn't update it themselves, then eventually they'll email me, and I can call the patient to get it changed. You want to decide on internet. I did see someone had a question on one of the other talks about using a mobile hotspot for your internet. I have used the mobile hotspot off of my phone when my internet went down, and it works just fine. I don't know if anyone's doing just that, but it is nice to know you can do that if needed. And then you're going to want to figure out some sort of phone system and your fax service early on, because you're going to want to put that on all your marketing stuff and your business cards. And then an inventory management system if you're going to be dispensing. And then the vendors here, there's all sorts of other patient communication you can do, some sort of cloud file like storage system, notes like to-do list organizer, dictation software, all sorts of stuff that can help you. All right, so this is all the stuff I had no idea about before I started looking into DPC. You want to pick a business structure. Most of the time, an LLC or PLLC is going to be the simplest to set up. And depending on what you decide to do, there's articles of organization or articles of incorporation. These sound like really fancy. It's not that bad. It's just like a simple form that you fill out and file. So just Google how to do it in your state if you haven't done that. And then registering doing business as. So what I was told by my attorney was my formal name is Blue Ridge Family Practice LLC. So he recommended just register this as doing business as Blue Ridge Family Practice. I mean, it seems obvious that those are both the same, but anyway, one simple form to file. And then you're going to need to apply for your employer identification number. You need this for paying taxes. It's also known as a TIN or tax ID number. And then especially if you have partners, you're going to want to have some sort of operating agreement or bylaws. So there's something called a registered agent basically, if you're able to receive mail at your address, you can be your own registered agent. If for some reason you can't receive mail, you can pay someone else to do that for you, but I don't really see why anyone would need that. And then make sure you remember to update your state medical license and your DEA with your new information. So Josh is going to talk about a business plan, so I'll leave that to him. In terms of needing a loan, again, I really favor doing it very low overhead. My husband and I just use some of our savings to cover the initial costs, but certainly try to keep the loans minimal, read all the fine print. For accounting, QuickBooks is great. That's what I use. You can connect your checking account and credit card. It can handle payroll if you do that. Again, that just kind of runs in the background. I can check as often as I want and see how everything is doing, but I don't have to enter anything. It's all just automatically updating. And then it is good to have an accountant because you will probably have questions. You may want someone to do your taxes. You're going to need to set up a checking account. You'll usually need your EIN and articles of incorporation or organization, so have all that ahead of time, and then a business credit card. Julie mentioned this in terms of disability, life insurance. I mean, these are things that's painful to pay for, and you hope you're never going to need it, but if you need it, you're really glad you had it. So getting all of that set up. The business insurance is like someone slips on a banana peel inside your office and wants to sue you. That sometimes a lease will have some specific requirements for the business insurance, so just look at that in your lease. And then we talked about malpractice. Medical insurance for yourself or your family. There are health share plans, which if you're not aware of those, it's really a good thing to look into. A lot of DPC physicians do use those for your families, and I also have a lot of patients who have them. So they function very similar to insurance, but they're not technically insurance. All right, Medicare opt-out. I think Phil is going to touch on all of this. This is me mailing mine. I was pretty excited. You want to make sure you're mailing this at the right time. So there's 4 quarters where it becomes active, and they have to receive it 30 days prior to those 4 quarters. And I've put on here the affidavit and the address to mail it to, because that is something that's kind of hard. It took me a while to find that. It's like Medicare doesn't want you to be able to opt out. So just you can click on those links or Google it and try to find it. For Medicaid, there's not a formal opt-out process, but some states may ask you to sign up as ordering or referring only provider. So look into that for your state. If you currently have insurance company contracts, you want to check sort of what's the requirement for ending those. Often it's 90 days. If you're employed, your employer may do that for you, and so just ask to have them confirm that in writing that they're doing it. And then you may need to provide patients with a list of nearby clinics, depending on your state. All right, since we all love paperwork, this is just a checklist of forms. And again, that DPC Docs Facebook group, sorry, I'm losing my voice. The DPC Docs Facebook group or the DPC Alliance are great sources for getting examples of these forms. So this is just a list of what you need. The enrollment form is just a way to often this is online. It might be associated with your billing thing. It's just a way to track who's in the practice and who isn't. How do people put in their name and address and credit card number or checking account. Patient agreement has been touched on. That's super important to just lay out what the practice is, how it operates. For Medicare patients, you're going to have them sign something that says they're not going to bill Medicare and neither are you. And then HIPAA, I think we're all familiar with. Release of information form, you'll need an employee contract. DPC Frontier has some discussion of these, and it might be a good idea to consult an attorney or at least talk to other people who have consulted an attorney. There's a lot of kind of DPC practices who have done all this. And then you might want some sort of just history form to make that first visit more organized. CLIA, this is something I was like, what? What is this? So this is basically you need to get a waiver to do in-office testing, and it's like tests that can be done over the counter. So I don't really understand why you need the waiver, but you do. So you can just Google that. You'll sign off on tests, and then there's an extra one if you want to do microscopy, and you can just check to see if there's any additional state requirements. You'll get a coupon to pay a fee, and then you'll get a certificate that you're approved to do over-the-counter tests in your office, and that just gets renewed every 2 years. And then proficiency testing, and I think the AAFP has something. There's various places you can go to kind of do your proficiency testing as needed for that. HIPAA, there's online tools to do a security risk assessment. You want to have the privacy practices available for your patients. They'll need to sign something saying they've had the opportunity to review that. And then any companies that handle your patient's health information will have these business associate agreements. OSHA, so this is my younger son. He didn't actually fall on the wet floor. He just felt compelled to lie down on the floor when he saw the sign there. This is why we don't go anywhere nice with our family. So if you don't have any employees, you don't need to worry about OSHA. It's something that applies to employees. Whether or not you have employees, you're going to want to find a biohazard disposal service. You want a fire extinguisher in your office. If you do have employees, it's some extra things like training them, printing an OSHA poster, knowing how to report incidents. So just kind of some things to check to make sure you're doing. And then marketing, we've kind of touched on this. I'm going to try to leave some time for questions. So again, really Facebook, articles, and your happy patients are really going to be your best resource for marketing. And then learning more. So really, I can't emphasize enough how important it is to have a community of other DPC docs. It can feel kind of isolating when you're doing this, when you're first starting, because sometimes the other doctors who are still in the system have, the sort of defense mechanism of like reasons it's not going to work or why you're a horrible person for leaving the system. And so it's nice to just have other people who understand and who are supportive. And honestly, like I have not met a single DPC doctor who hasn't been willing to help other people who are trying to do this. Again, the Alliance, who's here, DPC Facebook's the member interest group on AAFP. There's all sorts of ways you can connect with people, even if there's not people local close to you. Conferences, so this conference is great. I'm really thankful that the AAFP has continued to support this. There's also a conference called Nuts and Bolts that's in Orlando, Florida in November this year. It's done by Docs for Patient Care. It's another great conference. So, between those, I think keeping up with meeting people in person, there's nothing like that. I actually took a phlebotomy class just to practice before I opened because I had not drawn blood for about 12 years. But if there's things that you need to learn, just find a way to learn them, and it's fun. And then there's all sorts of websites and blogs. There's a book, actually, written by Doug Frago, who's a physician in Virginia. There's a policy manual, so that manual has everything you could ever want to know in terms of, like, compliance with everything. So if you don't want to try to gather all those forms yourself, you can download specific chapters, you can download the whole manual. It's like very, very extensive. So that is another resource. And then just remember, if you're smart enough to make it through medical school and residency, you are smart enough to start a practice. So one last question. How confident do you feel now? And so as you ponder that, I will tell you, this is my older son who at age 6 told my husband and I am the best athlete in the world, just point blank. And my husband and I had a friend who was a psychologist, and we asked him, like, should we try to, like, explain to him that he's actually not the best athlete in the world? Like, he might not even be the best 6-year-old athlete in the world. And our friend said, he'll figure it out eventually. Like, just let him believe it while he can. And so I think we all need a little bit of that, like, 6-year-old confidence that we can do this. So I'll wait and see how confident people are feeling. Okay, so I'm going to take a couple minutes. All right, so number one question here. What type of procedures do you include as part of the monthly fee? For example, would you charge extra for a skin biopsy or skin cancer excision? Okay, so yeah, there's lots of ways you can do this. What I've chosen to do is just charge to cover the cost of supplies. So like most of my things, I'll do $30 for like a laceration repair, major skin biopsy. If it's something that requires me to like open up a suture kit, basically, and you can just kind of price out your supplies and charge enough to cover that is what I do. Let's see, how do you handle the regulatory requirements? HIPAA. As a DPC, are you exempt from documenting medical necessity? I would recommend for any of these like HIPAA regulatory questions to look at DPC Frontier, which is that site run by Phil Eskew, because there's a lot of good information on there. And then how would you incorporate seeing patients in the hospital? So great question. Some some physicians do follow patients in the hospital. I do not do that. I had done hospital care for 9 years, and I was done doing that, and I really just wanted to be in the clinic. But what I do tell my patients is, please let me know if you are admitted, and I will stay in touch with you, and so I can talk to the specialist. I will visit patients in the hospital if I can. I will help kind of translate the medical speak in the hospital to the regular language that the patient and family can understand. And really, I think that's, for my patients, they're very appreciative of just my ability to do that. So I tell them, I can't dictate, I can't like force the hospital doctors to do anything, but I can help explain what's going on.